period. I recognize the Leader of the Opposition.
Great meetings in Ottawa. I met with Saskatchewan healthcare workers, those who work in uranium, those who work in oil and gas, all who are all, Mr. Speaker, being failed by this tired and out-of-touch government. And yes, Mr. Speaker, I met with Jagmeet Singh and members of the federal government, and I let them know that we oppose the carbon tax, that the home heating carve-out is unfair, and that we need a better deal on equalization. And I reached out to the Conservatives too, Mr. Speaker, but they couldn't make the time. And I made it clear where we disagree. Mr. Speaker, I also made it clear that where we can find common ground, Saskatchewan New Democrats will work to get a deal, whether that's a school lunch program, whether it's diabetes and contraception coverage, Mr. Speaker, or when it comes to leaving federal dollars on the table. Saskatchewan people expect their government to lead no matter who's in power in Ottawa. They expect them to act, Mr. Speaker. When will we see this Premier act, cut the fuel tax, and offer Saskatchewan people some relief that they need?
Recognize the Premier.
Welcome the Leader of the Opposition back, as well as other members that attended this meeting, Mr. Speaker. Maybe the reason they weren't able to meet with the Conservatives at this Labour meeting, Mr. Speaker, is they weren't invited. Mr. Speaker, the title of the Labour meeting was Labour Reps to Discuss Election Strategy. Mr. Speaker, it was publicly called a call to arms, Mr. Speaker, to plot strategy ahead of the federal election vote, Mr. Speaker, and to actively discuss election strategy. So, Mr. Speaker, if we can agree on the fact that one of the highest inflationary causes that we have in Canada today is the dreaded carbon tax, which is a tax on everything for everyone, Mr. Speaker. And if we can agree on the fact that the federal Liberal minority NDP administration is not going to remove that, Mr. Speaker, it is going to take a change in government in order for that to happen. So why then, Mr. Speaker, would the opposition members not support Saskatchewan families by attending a meeting that is going to keep that very minority administration in space, Mr. Speaker? We often hear of outcomes, Mr. Speaker, that are coming back from meetings that we may attend abroad, Mr. Speaker, of which are many when it comes to the economic improvement of our province, Mr. Speaker. Outside of Mr. Speaker, the NDP bringing back an election strategy on how to keep Justin Trudeau in power. What outcomes did they bring back from Ottawa?
Recognize the Leader of the Opposition.
Mr. Speaker, the Premier should know that Saskatchewan people expect more than huffing and puffing from their leaders. They expect their leaders to lead. They expect them to say no when the feds are on the wrong track, Mr. Speaker, but they expect them to get a deal done when there are federal dollars on the table that could benefit Saskatchewan people, Mr. Speaker. And that is exactly the job that I was doing last week in Ottawa, Mr. Speaker. It is also the job of leaders to set the tone for their entire team, and has become painfully clear that this Premier has lost control of his team. From the petulant House Leader to the Education Minister, who has done so much damage to the education sector in our province. A minister who asked a grieving mother, "What do they want from me? My firstborn," Mr. Speaker. Will the Premier do the right thing, and will he fire his Education Minister?
Recognize the Premier.
First and foremost, Mr. Speaker, on behalf of the government, Mr. Speaker, I would offer my condolences and our thoughts to Taya Thomas, who lost her daughter, Mael, this past year, Mr. Speaker. With respect to the comments that were made by the Education Minister when he had met with Taya after one of the sessions last week, I would say and agree with the Minister of Education when he says he selected a very poor choice of words. Mr. Speaker, he made a terrible mistake in that choice of words. He's apologized for that mistake. I understand privately, Mr. Speaker. He's apologized on the floor of this Assembly and apologized publicly in the rotunda, Mr. Speaker. With respect to the question that the Leader of the Opposition has, Mr. Speaker, in light of what is a very poor, in spite of what was a very poor choice of words by the Education Minister, of which he apologized for, Mr. Speaker, there is much that this Education Minister is doing that is in the best interest of students and our classrooms and our teachers across the province, Mr. Speaker, and he retains the full confidence of myself, the full confidence of his cabinet, and the full confidence of his caucus, Mr. Speaker.
Recognize the Leader of the Opposition.
Mr. Speaker, I've been around public education for a long time, from being elected as a school board trustee in 2009 to being elected here into this Assembly and serving as the education critic. And I have seen a lot of ministers in that time, Mr. Speaker, some better than others, but this is without a doubt the worst minister that we've seen yet. And he has shown time and again through his actions that he is not fit for this job. What does it say about that Premier's leadership and his judgment that he is keeping that minister in his place?
Recognize the Premier.
Mr. Speaker, I again would say in the Education Minister's admittedly poor choice of words, Mr. Speaker, of which he has apologized for privately, publicly a number of times, that this is a minister that has advocated, whether it be in caucus, whether it be in cabinet, whether it be at the Treasury Board level, Mr. Speaker, for the largest operational funding that the education sector has ever received in the history of the province. Not just the level of funding, Mr. Speaker, but the largest increase in operational funding that our school divisions, as the Leader of the Opposition indicated she has served with, has ever received. That included a significant increase as well for our supports that are going directly into the classroom, Mr. Speaker. And it also included a significant increase on the capital bills, Mr. Speaker, with 9 new schools being built across the province. That's adding to the 65 that are in process. All said, between new capital bills and major renovations, I believe we're at 102 total here in the province, Mr. Speaker. So this is an education minister, as I said, that has apologized for a poor choice of words last week, but continues to advocate, to engage with all involved in the sector, Mr. Speaker, and to advocate and to really find his way through ensuring that there is funding that is flowing into our classrooms to support our students' learning environment.
Recognize the Leader of the Opposition.
Mr. Speaker, it speaks volumes about that Premier's judgment that he continues to keep that Education Minister in his post. More than a poor choice of words, this is a poor choice for an Education Minister. One, Mr. Speaker, who on his first day on the job said that every MLA in that government had heard about the need for a pronoun policy. Mr. Speaker, not 5 minutes later, that same minister told reporters that that wasn't true. This is a minister who ran a bad faith campaign, a billboard campaign against teachers before they even got to the table, and one who has destroyed trust in the education sector. And the only thing that could turn that around is for that minister to no longer hold that post. Why doesn't the Premier have the courage to do that today?
Recognize the Premier.
Again, Mr. Speaker, in spite of what is a self-admitted poor choice of words, Mr. Speaker, of which the Minister of Education has apologized for, Mr. Speaker, the Leader of the Opposition is in many ways stating a number of the initiatives that this Education Minister has undertaken that are really relevant and I think supportive of the vast majority of Saskatchewan parents and Saskatchewan families' views. Most notably among that, Mr. Speaker, is the Parental Bill of Rights that was passed on the floor of this Assembly, Mr. Speaker, ensuring that parents have the ability to be involved in their child's school, classroom and education, one that has been opposed by the members opposite and I would say would likely be removed or retracted by the members opposite. Mr. Speaker, you add to that the record increase in operational funding, the addition of 9 new schools that are being built, Mr. Speaker, and to an earlier question on working with the federal government, working very closely with the federal government in the areas of early learning and childcare with over $408 million that's been transitioned It's been transitioned, Mr. Speaker. I think we were if I'm not mistaken, the third province to make an agreement with the federal government in this space to support Saskatchewan families, Mr. Speaker. And so this education minister does retain the full confidence of myself, Mr. Speaker, the cabinet in the province of Saskatchewan, Mr. Speaker, and I would say the caucus as well.
Here. Recognize the member from Saskatoon Eastview.
Mr. Speaker, this failing Minister of Education has got to go.
That's right.
On day one in his new job, he told reporters that every single member of the government caucus had taken a call about the pronoun policy. Minutes later, the Minister of Health then told reporters that that was not true. Later, he said he had received tens of thousands of emails about the need for the pronoun policy in just a few days. The real number, 18.
That's right.
This minister has shown that he does not have what it takes to stay in his role. If the Premier won't fire him, why won't he do the right thing and resign today?
Hear, hear.
Recognize the Minister of Education.
Mr. Speaker, when it comes to standing up for the parents of this province and ensuring that parents have a role in their children's lives, Mr. Speaker, this is a government that will always stand behind that. I am a minister that will always stand behind, Mr. Speaker, making sure that parents can be involved in their children's life, Mr. Speaker. On day one of the job, Mr. Speaker, I indicated to the media, Mr. Speaker, that every MLA had heard from constituents in regards to concerns around parental involvement, Mr. Speaker. That is why, Mr. Speaker, our government moved forward with Bill 137 in the fall, Mr. Speaker, and passed that bill in this House despite the opposition from the NDP, Mr. Speaker, again, to ensure that parents can be involved in their children's education in a whole variety of ways, Mr. Speaker. Again, this is a government, this is a premier, this is a minister, Mr. Speaker, that will always stand behind parents being involved in their children's lives.
Recognize the member from Saskatoon Eastview.
He didn't stand behind it when he voted against parental engagement right here in this Assembly. Mr. Speaker, under this government's watch, we've seen cuts in underfunding in our public schools. Well, under this minister, we've seen increases to private education. Under this minister, we've seen the longest teacher job action in Saskatchewan's history. We've seen all that failure followed up with personal attacks, a billboard campaign, and nothing but smarmy disdain from the current Minister of Education. Parents, teachers, and students deserve so much better. When will the minister face the music and resign?
Hear, hear.
Recognize the Minister of Education.
Thank you, Mr. Speaker. Mr. Speaker, again, I can tell the member's office, I can tell the House, Mr. Speaker, what I've heard from parents and teachers all around the province, Mr. Speaker, is that parents want to be involved in their children's lives, Mr. Speaker, involved in what's happening at school, Mr. Speaker, whether that's a Catholic school, a public school, a Francophone school, or an independent school around the province, Mr. Speaker. Mr. Speaker, my question to the member opposite, would he repeal Bill 137?
Yeah.
Recognize the member from Saskatoon Eastview.
Absolutely. We build a parental engagement strategy to get parents involved in education.
That's right.
Absolutely. Mr. Speaker, this minister has got to go.
That's
he
right.
has destroyed trust in the sector, and all of the problems that existed before he showed up have only gotten worse during his time. Now, if he won't resign because he's failing as a minister, he should resign for failing to apologize to Taya Thomas, the grieving mother who he told, "What do they want me to do? Give up my firstborn child." How does the minister think he can stay in his role after such a failure in leadership?
Hear, hear.
Recognize the Minister of Education.
Thank you, Mr. Speaker. Mr. Speaker, as I sit on the floor of this Assembly last week, Mr. Speaker, it was a poor choice of words on my part, Mr. Speaker. When I met with Ms. Thomas last week, I had the opportunity to apologize for my poor choice of words directly to her in our meeting, Mr. Speaker. I apologize on the floor of this Assembly, Mr. Speaker. But when it comes to addressing the needs of the sector, Mr. Speaker, that member opposite says things have gotten worse, Mr. Speaker. Mr. Speaker, let me tell you what we have now that we didn't have a year ago, Mr. Speaker. We have a multi-year funding agreement to deal with classroom support funding for all 27 school divisions, Mr. Speaker. Again, Mr. Speaker, something that school divisions have been asking for several years, Mr. Speaker, something that this government was able to deliver on in this year's budget, Mr. Speaker. Not only do we have predictability over the next 4 years, Mr. Speaker, but we also have a 14% increase in classroom supports funding.
Recognize the member from Regina Walsh Acres.
Thank you, Mr. Speaker. This tired and out-of-touch government just doesn't care anymore. They don't care about our kids, they don't care about the most vulnerable, and they certainly don't care about the 49 nurses that wrote to the minister raising the alarm over our over-reliance on contract nurses. Mr. Speaker, we learned in committee a couple weeks ago that they have spent $59 million on contract nurses last year. And of course, they wouldn't tell us how much they plan to spend this year, but Sun is projecting that it'll be nearly $70 million. How does the minister justify spending $59 million on contract nurses?
Recognize the Minister of Health.
Thank you, Mr. Speaker. As we discussed last week, when necessary, the SHA utilizes contract nursing resources to be able to balance temporary service disruptions, Mr. Speaker. Again, as we talked about in committee, the reasoning, the rationale for that to make sure that we can provide for coverage in these areas, Mr. Speaker, and temporarily doing that so that the nurses do have the ability to take vacation time, or if they happen to phone in sick, Mr. Speaker. Now, as I've said before, and I'll say it again here today in the chamber, Mr. Speaker, we're going to continue to work through the SHA to make sure that we keep filling vacancies, training more healthcare workers, hiring more healthcare workers as part of our HHR action plan, and reduce the overall reliance on contract nurses in this province in the months and years ahead, Mr. Speaker.
Hear, hear.
Recognize the member from Regina Walsh Acres.
Mr. Speaker, these contract nurses were supposed to be a temporary fill-in-the-gap solution, but the numbers show that they have become a baked-in part of this government's staffing plan. We've gone from spending a couple of millions of dollars a year to nearly $70 million just this year. It is clear that this government's human health resource plan isn't working. We know that. The nurses at the emergency room at St. Paul's Hospital know that. Will the minister admit today that his plan isn't working and finally say yes to Sun and their nursing task force idea?
Recognize the Minister of Health.
Thank you, Mr. Speaker. I know the member opposite, he doesn't want to hear it, but the Health Human Resources Action Plan, it is working. It is working in our cities. It's working in our rural communities, Mr. Speaker. $140 million invested into this action plan, creating new permanent full-time positions across Saskatchewan and many rural communities, new hires that are happening as a result of that, Mr. Speaker. And that also includes work that continues to be done filling vacancies that we have in our urban centres as well, Mr. Speaker. I can report to the member opposite that in the St. Paul situation, I've seen the letter. I've had the opportunity to meet with nurses there directly and talk to them on a regular basis, that 5 nurses were hired in the emergency department in January, Mr. Speaker, and they're now able to work fully and independently. Mr. Speaker, in addition to that, 2 more RNs started in March. They're expected to work independently by the end of May. That's the list of some of the results that are happening when it comes to our HHR action plan. More to come, Mr. Speaker.
Recognize the member from Regina Walsh Acres.
Mr. Speaker, $59 million last year, on track for $70 million this year. That's almost $300,000 per nurse, triple what a typical in-house nurse is paid. I'll read what the nurses said to that minister in the letter. Quote, "This significant disparity in perceived value leaves the permanent staff feeling frustrated." End quote. When staff are feeling frustrated and undervalued, Mr. Speaker, they leave. When will we see an actual retention plan, one that ensures that we don't lose any more nurses?
Recognize the Minister of Health.
Thank you. Mr. Speaker, and that retention is an important part of this government strategy, in addition to the recruitment and their training, retaining of healthcare workers, training of healthcare workers, Mr. Speaker, to make sure that we do have the necessary staff to be able to fill these vacancies and continue to build the healthcare workforce, Mr. Speaker. We have a growing province and growing demands on the healthcare system. It's why we're adding more beds across the system, Mr. Speaker, hiring more staff so that we have more services for people right across this province, Mr. Speaker. Over the next 2 weeks, St. Paul's Hospital will be interviewing 12 RNs to fill the vacancies, which is a good sign, Mr. Speaker, that there are nurses wanting to work in this department. That will reduce the reliance on contract nurses, Mr. Speaker, and that work is going to continue.
Hear, hear.
Recognize a member from Regina Elphinstone Centre.
Thank you, Mr. Speaker. Instead of taking real action on the worst in the country wait times on knee and hip surgeries, this government has handed a $6 million sweetheart deal to an out-of-province donor, a donor whose lobbyist was the Sask Party's own finance minister, Kevin Doherty. Saskatchewan people want answer, Mr. Speaker, to the minister. Did Kevin Doherty lobby him on the issue of surgical backlog, either in his role as Minister of Health or in his previous role as Minister of Rural and Remote Health? Yes or no?
Hear, hear.
Recognize the Minister of Health.
Thank you, Mr. Speaker. The member opposite continues to ask the same questions that she had last week. Mr. Speaker, it gives me an opportunity to talk about our surgical initiatives in this province. $670 million into surgical initiatives in this budget, Mr. Speaker. And one thing that our government is doing is pursuing all options when it comes to accessing and improving access to joint replacement surgery, Mr. Speaker. Since 2010, through privately operated, publicly funded surgical centres in this province, and also through initiatives such as this, we've been able to provide 161,000 surgeries, Mr. Speaker, since 2010. Mr. Speaker, as I said previously, it's important that we are giving long waiters on the surgical wait list options to be able to get the surgeries they need, and that's what we're going to continue to do, Mr. Speaker.
Recognize a member from Regina Elphinstone Centre.
Yes, Mr. Speaker, I've asked some of these questions before. The problem is the answers keep changing, and I think just right there we didn't get an answer at all. This is the minister who said that there was an RFP, an open and transparent process, and then he said there wasn't. A week ago, he was claiming that he probably hadn't even met with Kevin Doherty. Then he acknowledged he did, but it was about something else, but he can't remember entirely what it was, Mr. Speaker. So I'll ask another question about this, Mr. Speaker. Did the health minister meet with Kevin Doherty, either in his role as health minister or previously as Minister of Rural and Remote Health, on the surgical backlog, yes or no?
Recognize the Minister of Health.
Thank you, Mr. Speaker. The member for Elphinstone Centre, she keeps her question sheets from last week and she scribbles a few different words on it, tries to change it up, and then she can't be patient enough to wait for an answer because she just sits there from across the back there, Mr. Speaker, and yells across the way. That's how she conducts herself, Mr. Speaker. Mr. Speaker, we continue to make significant investments into these initiatives, and we meet with many people. As I've said in this chamber, and as I've said out in the rotunda as well, we meet with many people, Mr. Speaker. As an example, last fall, a number of us on this side of the House and the other side of the House also met with the former NDP MLA for Saskatoon-Riversdale, Danielle Chartier, in the Saskatoon Community Clinic. They hosted a lobby night for MLAs, Mr. Speaker, alongside other well-known NDP members, Frank Quinnell and Sherry Benson. Do they not want us meeting with the Saskatoon Community Clinic, Mr. Speaker? That's how, I guess that's the question I would like to ask that member opposite, is who would she meet with and who wouldn't she meet with, Mr. Speaker?
Recognize a member from Regina Elphinstone Centre.
Except he's the minister, Mr. Speaker, and he's so far failed to answer a very basic yes or no question. And you know, Mr. Speaker, I'm getting kind of worried about the health minister. I'm worried about his memory. He's really struggling, but don't worry, I can help him narrow it down. Kevin Doherty only lobbies the Ministry of Health on behalf of 3 organizations. One is an ambulance company, the other provides dementia care for seniors, and one is a private surgical provider in Alberta. So again, we haven't heard an answer to this question. Did he meet with Kevin Doherty, either in his current role as Minister of Health or before as Minister of Rural and Remote Health? Yes or no?
Recognize the Minister of Health.
Thank you, Mr. Speaker. I answered the question last week and said yes, I did meet with that group as recently as 2 or 3 weeks ago, with Medavie as an example, Mr. Speaker. So to help the member opposite's memory, just to remind her again, this would be on Hansard and it would be in the media as well, Mr. Speaker. Again, I've answered that question. Finally, Mr. Speaker, I would just say this: we're going to continue to make record investments into healthcare. And the member opposite says something to the effect is, well, you're the minister, you should know these things. I can tell you what, Mr. Speaker, what the people of this province will never do is make her the minister of anything, Mr. Speaker. They made that change in 2007. They reiterated in 2011, 2016, 2020. We'll see what happens in October of 2024, Mr. Speaker.
Hear, hear. Recognize the member from Saskatoon University.
Mr. Speaker, every year our province sets a new record for overdose deaths, with more than one person dying of overdose every single day in this province. This government knows this, yet they cut supports and services in our communities that save lives. In Alberta, similar addictions policies have seen a stark increase in the rate of overdose deaths. In that province, overdose deaths have risen by 25%, Mr. Speaker. How many families have to lose their loved ones to this crisis before the minister will realize that his plan isn't working?
Recognize the Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. Mr. Speaker, no illicit drugs are safe. No illicit drugs are safe. There is no safe use of an illicit drug. And I know the members opposite want to desperately convince the communities across Saskatchewan that there is somehow some safe use of an illicit drug. They want to flood our streets with needles and dirty crack pipes, Mr. Speaker, but that is not the strategy of this government, Mr. Speaker. Mr. Speaker, our government is focused on treatment and recovery to help the individuals who need the supports necessary to overcome addiction. And that's why we are expanding addiction treatment spaces. We're making it easier for individuals to access those spaces, and we are wrapping the supports that they need to recover around them so that they can live healthy lives in recovery. Thank you, Mr. Speaker.